Signed up to actually get the coronavirus will now have a chance to do that.
As medical reporter Liz Bonus explains, researchers in the UK are about to launch the world's first COVID-19 challenge study.
Hey there, hello to you and to you. A human challenge study actually allows those who participate to be infected with a live virus. In this case, that live virus, COVID-19.
Those such as Thomas Smiley have volunteered to participate in challenge trials.
If I need to be the person to step up to provide my body, to provide more data, provide more help in any way, why not?
Thomas is part of a group called One Day Sooner.
One Day Sooner is a nonprofit organization that advocates on behalf of volunteers for a potential COVID-19 human challenge trial. That's a trial where volunteers would be deliberately exposed to the coronavirus under controlled conditions to quickly test vaccines and learn more about COVID-19.
Some of the volunteers that are part of One Day Sooner have been accepted into this new challenge trial. It is only for those at low risk for complications. But in this first trial to launch, they will be housed in a biosafety level 3 hospital in London and closely monitored because infectious disease specialists warn this does not mean this study is without risk.
I think it's very concerning to give patients a potentially lethal virus when we don't know if the treatments that we have really work to prevent patients from dying from it. So I think there are going to still be a lot of issues from an ethical standpoint about whether challenge studies are safe and ethical.
Now, the first step expected in this trial is what's called a characterization study. It's expected to begin in January, and it would deliberately expose a very small number of those healthy volunteers to the virus to determine the minimum dose that leads to an infection with symptoms. Ethics approvals are still needed from regulators as well. They would likely be between the ages of 18 and 30, the volunteers, and we could have at least preliminary information in just a couple months after that follow. Challenge trials are used right now to fight other diseases, cholera, typhoid, malaria, even the flu. We'll share the latest when we get it. I'm medical reporter Liz Bonus. We'll throw it back to you.